Okay, so today's topic is reproductive embryology. So, in order to remember the early embryonic development, the mnemonic to remember is sticky BLT needs heart, limbs, and gene 8. So, if we talk about the week 1, in week 1, there is a development of blastocyst. So there's a sticking of the blastocyst. You can remember by the word sticky, and there's implantation and there's a starting of the HCG secretion. So sticking starts at the day of 6. So you can remember this by the word sticky. Baby arrives. Then in the week 2, there is bilaminar. There is formation of the two layers, that is epiblast and hypoblast. So bilaminar is for the B, that is 2, and at the week 3 there is trilaminar. There is going to be 3 layers: ectoderm, mesoderm, and then endoderm. Via the gastrulation process, there will be a formation of the notochord, and notochord will give rise to the structured neural plate, and neural plate will form the neural tube by the process neurulation. You can remember the neural folds or the neural tube as folding a taco. A flat sheet, when it's a flat sheet, there's a neural plate, and the dip in the flat sheet is a neural groove, and the sides which are raised are the neural folds, and when they close like a neural tube. Then in the week 4, so sticky, B is for bilaminar, L is for NT is for the trilaminar, and N is for the notochord. And then in week 4 there is development of heart and limbs, and then in the week 8 there is a formation of the genitalia that define the gender. So you can remember gender at 8 or gene 8. So the mnemonic is the sticky BLT needs heart, limbs, and gene 8. This mnemonic is for the early embryonic development. Then we talk about the neural crust cells. Neural crust cells are S100 positive, and the derivatives of the neural crust cells can be remembered by mnemonic EMO passes. So there are in this derivatives there are some component of the peripheral nervous system and some component of the non-neuronal cells. So if we talk about the EMO is the enterocells, melanocytes, odontoblast, and then for the word passes, P is for PNS glia. Then we have the adrenal medulla, and then we have the Schwann cells, and then the spinal membrane and endocardial cushions, and the other S is for the skull bones. So neural crust cells, the derivatives can be remembered by the mnemonic EMO passes. Then let's move on. So next is the derivative of the 3 layers. That was a trilaminar layers, that is the ectoderm, mesoderm, and the endoderm. So if we talk about the ectoderm, the mnemonic is pretty little eyes open and people smell milky sweat. It's a weird mnemonic, but it's very important for you to remember the layers of the ectoderm. They are frequently asked in exams. So pretty is for the P, that is a parotid gland. Little is for the lens of the eye. Eyes is for the epidermis. O is for the oral cavity epithelium. And is for the A, that is the anal canal, that is present below the pectinate line. The above pectinate line is the derivative of the endoderm. P is for the pituitary, that is adenohypophysis from the Redke's pouch, and there is one tumor, benign tumor of the Redke's pouch, craniopharyngioma, which you also need to know. And then the S is for smell is for the S, and S is for the sensory organs, that is the ear and the nose. And the next thing is the M. M is also for the mammary glands, and sweat is for the sweat glands. So pretty little eyes open and people smell milky sweat. Then we talk about the mesoderm. The derivatives of mesoderms are like there is a long list of the derivatives of the mesoderm, but the mnemonic is also pretty long, but very easy to remember. My big, cool, strong heart loves blood very kindly and develop tough organs and microglia. So my is for the muscle, big is for the bones, C is for the connective tissue, S is for the serous lining, H is for the heart, L is for the lymphatics, B is for the blood, V is for the viscera, K is for kidneys, and A is for adrenal cortex, D is for the dermis, and T is for the testes, O is for the ovaries, and M is for the microglia. You need to remember that there is association of the vectoral association with the derivatives of the mesoderm. Then we talk about the endoderms. Endoderms can be remembered by the word eats and expand organs. So it's they derived the gut lining and the anal canal that is present above the pectinate line, and the organs. The mnemonic is little people take tiny pills like good pharmacist. Little is for the lungs, and the P is for the pancreas, T is for the thyroid, T is for the thymus, P is for the pills, and P is for the parathyroid, L is for the liver, L is for the like, G is for the gallbladder and good, and P is for the pharynx and the pharmacist. So little people take tiny pills like good pharmacist. This is a mnemonic for the endoderm. Now let's move on. So if we talk about the teratogens, there are different teratogens. They can be medicines, they can be substances, and then there are some other things that can also affect the baby. So if we talk about the medicines, then that mnemonic can be angry ants always fight fierce iguanas like mad tiny wolves. So angry is for the ACE inhibitors. So you need to remember that ACE drives the baby, so it causes the oligohydramnios. The next A is for the alkylating agents, that is the one that attack the body parts, and organogenesis affects the organogenesis. The other A is for the always, that is aminoglycosides that cause the damage to the ears. And then F is for the fits, that is anti-epileptics, affects the baby formation, can cause baby malformations. Fierce is for the folate antagonist that can affect the neural, that can cause the neural tube defects.